So I'd like to invite, please, Alex Blomfield up here, who's going to talk about the Bay, a blueprint for recovery, a person-centred approach to well-being in nature, and then we'll have a Q&A and then we'll have a break. Alex.
Lovely. Thank you for inviting me here today. So I'll be talking a little bit about some of the evidence around nature-based social prescribing, drawing some examples from the work that myself and colleagues have been doing over the last 2.5 years as part of the Bay, a Blueprint for Recovery, which works all around Morecambe Bay. But before we get started, I'd like to draw your attention to the QR code at the top of the screen. Please connect on Slido to enable you to participate in the interactive session after the main presentation. It will be on slides throughout. So to get us started, there is a wealth of evidence around the well-being benefits of nature connection. Often when we're outside, we tend to be more physically active, and this has physical and mental health benefits. But more than that, connecting with nature helps us to feel more relaxed. It boosts our mood, and it drives feeling of connection. These days, green social prescribing, so using nature for well-being, has become more well established, and more recently the value of blue spaces around rivers, lakes and the coast are becoming recognised. So we know that nature is important, but as a community we're becoming increasingly disconnected, both from nature and from other people. And we know that nature is in trouble. Almost half of the UK's wildlife is now in population decline. So really, nature connection represents an opportunity for people and nature's recovery. And often it's people in the most deprived areas who find it the most difficult to access nature. So around the northwest, for a number of years now, the Lancashire Wildlife Trust has been running nature and wellbeing sessions, particularly around Bury, Preston, Blackburn, and Greater Manchester. These were formerly known as My Place, you might have heard of those. And these are really helping to connect those in the community who are most at need with nature for the well-being benefits. And then coming out of the global pandemic, the Bay, a Blueprint for Recovery was born. So we draw on the expertise of the Lancashire Wildlife Trust and are a partnership that also work with the Wildlife Trust in Cumbria and the Eden Project. We're a non-clinical service, but we also work with the NHS. And we cover all around Morecambe Bay. We have delivery areas in Barrow, here in Morecambe, and down in Wyre. And we're unique in combining a blend of blue and green social prescribing, but also in the way that we operate. So here you can see we operate over 3 levels. Today I'll be mostly focusing on our specialist level, but I wanted to give you a little bit of a broader context about how we work. So at the top, with our specialist interventions, these are our nature and wellbeing sessions, and these are a person-centred approach where we take referrals both from the NHS, community groups, but also from individuals who want to self-refer. And we work in small groups, getting people outdoors, using green spaces and blue spaces that are close to the community, and really helping people to learn about nature and how that can benefit well-being. Then at our targeted approach, we have broader events in the communities. These are things like litter picks, things that are really good for families, but also training events that can help people to build skills and go on to employment. And then we have our whole population approach. So this is often through digital engagement. We have a range of online talks, blogs, and resources that people can download in their own time to self-serve and go and access nature and have a positive impact on our local environment. And with our wellbeing sessions, people often ask me, what do you actually do? So all of the activities, it's very person-centred. We look at who's coming along to the groups, their physical capabilities, their interests, but something we structure all of our sessions around are the 5 ways to wellbeing from the New Economics Foundation. So we have connect, give, take notice, be active, and learn. And we use nature to embed the 5 ways. So on the left, here we are down on the Fylde coast, planting Christmas trees into sand dunes to help stabilise the sand. And we do lots of activities that give back to nature We do wildlife surveys, making back boxes. Things like this really help to empower people, giving them a positive focus, boosting self-esteem. And in the groups, we're working together towards a shared goal, and that's something that brings about camaraderie and companionship, helping people to connect. When we're outdoors, it's a really low-key environment, and people feel able to be themselves and to have really authentic connections with others. There are lots of opportunities in nature to slow down and take notice. When we're walking along the beach looking for shark egg cases, it helps us to be more grounded in the moment, and that's really important for mental well-being. Being active, it's not just about nature walks. There's lots of ways that we can increase our physical activity through nature, a little bit of gentle gardening, and learning. There's always more to learn in nature, whether it's bird watching, learning about species ID. There are lots of opportunities, and that's something that's great for people's self-esteem. We also offer ways for that learning to be recognised through AQAs and John Muir Awards. And so I think at the heart of why social prescribing is so important is because it goes beyond what's possible with traditional medication and therapies. We're creating long-lasting, meaningful friendships and connections. We're helping people to move on to volunteering and employment. I think it's amazing that currently Lancashire Wildlife Trust staff force, 6% of people started their journey with the Trust through participating in wellbeing sessions. And many more go on to volunteer with us or other organisations locally. So it's about giving people skills, but more than anything, the confidence. I think our sessions really enable people to change their outlooks in life. We've got really diverse people coming along to our sessions. I've worked with people right from their 20s through to their 80s, people from a range of different backgrounds and experiences. And the level of peer support that we get through that is really inspiring. So you can take my word for it, but I wanted to share some of the testimonials from our group members. So it's helped me to feel more grounded. When I go out now, I take more notice of the nature and the birds rather than thinking of the people and anxiety of being out. And I think that's something that really demonstrates that we're helping people to build skills that they can take beyond our sessions and into their day-to-day lives. I mentioned that the Bay came about as a result of the global pandemic and helping people to get back out into nature. I'm sure many of you know that for many people, the pandemic has really still been ongoing. We'd been shielding for the last 4 years. The only place we'd been was hospital appointments. So this has just opened our world. We've grown in confidence with the group. It's changed things for us completely. And I think it's amazing to see just how things can change completely for some people in a relatively short amount of time, and that coming along to a small group like ours can give people the confidence to go on and do other things. So this couple now go to the park run in Morecambe and they're joining other groups. So I wanted to wrap up this section of the presentation by sharing a short video which gives you, sorry, we've got a little bit more. So evidence, that's the really important thing before I skip over that. So we had an evaluation of the work of the Bay, and which was done by Lancaster University, and it showed that we have been successful in engaging people in the population who are in that lowest 15% bracket for mental well-being. So we're working with the right people, and we are making a difference. 95% of people experienced improvement in their well-being after coming along to 6 weeks of our programs. So clearly this has huge individual benefits, but there are also wider implications for the NHS in terms of cost saving. An analysis of my place's work around Bury and Rochdale found that for every £1 invested, that leads to a healthcare cost saving of £2.16. And that figure actually rises if you consider employment-related costs for people that are too unwell to work. There we go. So I'll share the video now.
I think because of COVID, I lost quite a bit of confidence with things.
It made my social anxiety so much worse. I felt like I couldn't face the world again.
There was times where I was struggling to go outside.
It's like I'd forgotten how to talk to people. I just wanted to stay in my room. I didn't it just felt too daunting to think of, oh, I have to go out now and speak to people and get a job, and it was just too much.
Finding a new community when you move is difficult, especially in today's day and age.
I got told by my mental health support worker there's a thing called My Place, which is now the Bay, of course.
It was a self-referral process. It's quite easy. I just put my details in on Facebook, I think.
I rang up and joined to see what it was like, and I just love it now. Nature is essential for your well-being.
I would never have touched seaweed 4 weeks ago. No way. But now I know there's so much stuff in it, and it's cool.
It's given me a new appreciation that I never had before. You know, when you're stopping and focusing on a detail or a new species, you're very grounded in the moment. And I think that for mental health is just amazing.
I think because it's normally such a small group, I'm quite comfortable coming now. And even if you don't feel confident enough to come on your own, like they don't mind if you want to bring your mum or partner or friend.
This group has really helped me. I feel it's like a complete and total safe environment, and I feel like I'm really safe with the people in the group. It's kind of like we share the same experiences as well. It feels like we're in this thing together, more in the same boat, and it's just a really wholesome thing. I've made friends with all the guys in the group. I really like them, and that's given me confidence. That's made me feel better about myself. It just really grounds you. I look forward to it every single week, and I come back feeling so much better than I did before.
At the end of the day, it is all just trying to help you get back out there. I think it's definitely worth it. My well-being has increased from coming. I know it can be really difficult making the first step, but really the first step is the most important one, because you're never going to know if you like it or you don't like it if you don't try it.
I just feel like I'm on the right track now. I'd recommend it to absolutely everybody. I think they should prescribe it on the NHS, genuinely. I'm just so glad I joined.
So we heard there from some of the people who've come to some of our groups, including Gareth, who's now one of our star volunteers. But for the next part, please connect on Slido if you haven't already. And we'll get this part started with a short poll, just to have an idea of the sort of engagement we have already in the room and online. So asking if you or your team currently work with nature-based social prescribing projects like the Bay. While we're waiting, have a chat on your tables, see if other people have referred people in the past, if people have worked with organisations like ours, and if not, maybe why not? Okay, I think we'll move on to the next question. So it looks like the majority of people here haven't worked with projects like ours before. So leading on from that, what sort of barriers do you think might be in place that prevent clinicians from referring to nature-based social prescribing projects? I'll come round and ask for a bit of feedback from tables in a moment. It's gone very quiet. You are allowed to talk to each other. Maybe if on your tables you choose one person to feedback and I'll come round with a microphone.
Mostly lack of awareness, I think. I don't know what's available in Bolton, which is where I work clinically.
So do you have any ideas about how maybe we could get the word out to clinicians like yourself?
We always talk about training and education, but that in itself is often not enough. It's not a system like structural change, because particularly training doctors and rotational people move about all the time, so you just rapidly lose awareness if that's your method of like implementing awareness. So again, I kind of always just talk about the challenge of creating a system change and a cultural change, which is social prescribing should be something we all see as something that we can offer.
Thank you. Right. Have we got some feedback from this table?
Sorry, I always get the blame for this, but the timekeeping is slipping. No, don't, not stopping you. Can we keep this going? But can we keep this going, acknowledging that people have been nipping out to use the facilities, to get a drink, to refresh their cup, to get some food and come back in, if you don't mind, so we can sort of have an active working break and keep this, if that's not too disruptive for you. So we'll give you that right through the break time to be able to do this, and a bit after to sort of wind it up when everybody's finished, and then move on to the next session if that's okay. So please do keep working, and we will keep bringing the presentation will happen as we're doing that. So if you can try and do it without chatting too much, except about what we're supposed to be doing. If you want to have a network chat, please do it outside, not in here. Sorry, you carry on.
That's great. I'll come back to that. So I'll move on to our second discussion question, which are, given the barriers, what would enable clinicians to work more closely with nature-based social prescribing projects?